Good evening, everybody. I am Moira Bradfield from Dermatitis, and we're going to have a discussion tonight on itch and pain. And when we're talking about itch and pain, we're talking about itch and pain in relation to gynaecological health, vaginal health, and dermatology. So I guess one of the things I wanted to have this little chat is we often, possibly, I know clients do fall into the trap of thinking, oh my gosh, it's an itchy, that's a thrush situation, when really if we're taking itch down its differential pathway, we need to be thinking about a hell of a lot more than thrush. And we need to be asking questions that can include and exclude different types of diagnoses, essentially. And we have to run through all of those usual things like the quality of the itch, the timing of the itch, when did it come on, where is it associated with anything, does it radiate anywhere, what specifically does it feel like, how long does it last for, what makes it better for you, does anything make it worse for you, and of course those frequency type questions. And those type of things give us indications of what might be going on. So I wanted to talk to you because when we're looking at itch or pruritus as a symptom, that, as I said, thrush is a differential diagnosis, and there are things that we need to consider in terms of the lifespan and where somebody may be sitting in their lifespan, because it may mean that they're more predisposed. So, for example, there are certainly a lot of pregnancy type itches, and there are itches associated with atrophy, for example, in menopause. And that we may see some things being more common in terms of itch-associated diagnoses in childhood and adolescence than they are in menstruation and general middle part of a female lifespan. And so I guess I wanted to talk about this because linked into this is still our considerations of vaginal pH and immune systems in that area and what might be going on. And we know that when the pH actually raises, then we have the proteinase activated receptors are more likely to be activated, and they are mediators of itch as well. So they are responsible for that itch symptom. So pH is something to consider. The other thing to consider is that the most likely diagnosis when we're talking about itch is actually a dermatitis type diagnosis. And so as clinicians, we need to run through what that actually might be for that person. For example, for that person, have you changed your toilet paper? Have you got a new soap? Have you started shaving? Is there a different razor with a different lubricating strip on it? All of those type of things, underwear, new liners, new tampons, new body washes, are you using feminine wipes, is there a lubricant, a new partner? These things are important for our diagnoses of these particular issues when we're talking about itch. And so the other interesting thing, if we do move it into vaginal infection, for example, is that BV doesn't really have an itch. It is a vaginosis versus a vaginitis because it differentiates the type of tissue damage that's occurring. And so we see a lot of itch associated with thrush, but not much with BV. The other thing that we need to consider when we're looking at those two diagnoses is that sometimes this itch that people are going, this is thrush, may be thrush but low level reaction, or it may be moving into things like vulvodynia. And when we're looking at those, we also need to start screening things like pain. And so pain, again, in the genital area is a pretty important symptom to get all of those cardinal information about in terms of where it is, what it's associated with, what relieves it, what aggravates it, what does it feel like, when do you get it, how long does it last for. And we need to get that information as well in relationship to sex and sexual penetration. So that can give us some information, because when we're looking at pain on intercourse particularly, so dyspareunia, then we have all these different differentials that come from that in terms of pelvic inflammatory disease or lichen sclerosis or vulvodynia or vestibular disorders, or we may be looking at some psychological disorders. We could be looking at atrophy, we could be looking at thrush, We could be looking at so many things that are important that we have to be asking the questions for. So if we're not asking the questions, how can we expect to get that information? And it's the quality that gives us that information, the timing that gives us that information. For example, if we're looking at things like pelvic congestion, that's often a symptom that comes on after intercourse, that deep aching that can last for a period of time. And if thinking about pelvic congestion, what is the cause of that? Is this a pelvic inflammatory disease? Is there some sort of endo going on there? If we've got pain that is more burning in nature, then that could be a thrush type pain or an atrophy or a lubrication issue. And those issues also move into hormonal components or psychological components as well for us. So what I'm trying to get at is that these are important symptoms we need to be aware of, that we shouldn't be jumping to the conclusion that this is psychological all the time or that this is thrush based all the time. We need to ask questions if it is associated with sex pain. Partner questions are important too. Position questions are important in that. Sexual dysfunction questions are important in that for our differential. And the timing, the discharge, if there is any, ease of lubrication, use of lubricants, history of STIs that might give us some indication of pelvic inflammatory disease, or if we're looking at pain and itch, things like herpes lesions, seen or unseen, might be something we need to be considering. Past trauma, episiotomies, genital surgery, abdominal surgery, bowel surgery, all of these things that might affect the architecture or the anatomical components that may influence pain in that area, nerve pain, for example, and then we spread out. And so this is an area where we really need to be using our differential skills, and we need to be asking those questions. So I'm going to post some resources on the page, probably tomorrow now, that have some really fantastic lists in terms of differential diagnoses with pain, particularly pain on intercourse, and also some articles talking about itch and the differentiation of itch, because there's symptoms that come up in this area all the time. And it's really great if we can ask the right questions clinically to get the information clinically that will give us what we need to be able to diagnose or to be able to offer relief to somebody and direct them in the right way or the right place to get a proper diagnosis. And that also helps us to mediate risks, because if we are dealing with things like lichen sclerosis, for example, there is a 5% risk of that actually turning into a cancerous condition. And so proper management, monitoring, biopsy, all of those things are really important. So if you've got any questions, you can pop them down below in the live. Thank you very much for watching. And I've got some great training offers coming up soon, which will be the level 2. But if you haven't done level 1, you obviously can't do level 2. But I'll have some offers on a replay of level 1 as well for you. So ask your questions, everybody interact, and I'll talk to you soon. See ya.